Good morning, everybody. Welcome to another exciting episode of the Upper Cervical Corner. My name is Dr. Kramer, and I am excited to talk to you today about the idea of what to do when every single test comes back normal. Today, we are going to explore this idea because so often what I see happen inside of my practice is I have a patient sit down across from me and say, "Hey doc, every test came back normal." And so what's interesting to me is how we choose to follow the symptom chasing trail that is a product of what our family of origin has taught us, that is reinforced by the media, and is also cultivated by the narrative that we are sold regarding how we achieve health in this country. And what's really unique about this is that when we are on this pathway, we usually seek out answers that have definite results for us, right? For example, if I suddenly come down with a scratchy throat, a congested sinuses, my eyes are itchy, I'm running a fever, the very first stop for most of us is going to be to our primary care physician or one of the doc-in-the-box ERs. And you're going to go in there and you're going to say urgent care, right? You're going to go in there, you're going to say, this is what I have going on. The doctor is going to listen to the symptoms. They may say, hey, this sounds bacterial, we're going to run some tests. Or this sounds viral, we're going to run some tests. And based upon the test, we're going to make a recommendation of care. You may get a steroid, you may get an antibiotic, you may get some Tylenol, and they may say, hey, this should clear up in 7 to 10 days. And if it doesn't, come on back. And magically, for most of us, within 7 to 10 days, we are cleared up. However, today I want to talk about the other side of the coin, and that's what happens when everything comes back normal. Meaning, you go to the primary care, you go to the urgent care, let's say you have a bout of vertigo, or you have a bout of migraines, or whatever it may be, and you're seeking the root cause. Like, why did this happen? Where am I going? How do I get rid of this problem that I am suffering from? And your PCP says, hey, this sounds like X. We have some drugs. We're going to try it out. But I also think it's necessary for you to have some further testing done, right? Maybe you need to go to the ENT. Maybe, this sounds like a neurological problem, so we'll go to the neurologist. Maybe this sounds like an orthopedic problem, so we'll go to the orthopedic. And in your process, you say, okay, great, let's go find each one of those out. We start at the ENT. The ENT checks out your sinuses. They look in your ear. They tell you, hey, look, everything looks great. This is not a problem that I can help you with here. I'm sorry. Let's go talk to the neuro. You go to the neuro, and the neuro goes, hey, let's do some imaging, some further testing. We're going to do some MRIs. And then the MRIs, like 99% of them come back normal. And you're like, doc, I thought the MRI was going to expose something. And he says, well, what it did show us is that there's nothing underneath it. There's no problems with the foundation. And you say, okay, great. Well, then how do I have this problem and how do I get rid of it? And they say, we don't know. Then you talk to the orthopedic, and the orthopedic says, well, I'm going to do some x-rays also with the MRIs. And, it doesn't really match up. So I'm sorry. And then there you are lost, wondering, right? You're given a prescription. You try the medication, but you don't like the side effects. You're like, what is the root cause? What am I doing with my life? How do I solve these problems? And then somehow you get on a forum and then you find out that there's this thing called Upper Cervical Care, and you end up in my office and you sit across from me and you tell me, hey doc, all these tests came back normal. Why am I still suffering, right? And what's fascinating to me is that there's a couple of avenues that we can go down. And that's the fact that most of the diagnoses that are done by Western medicine are designed to treat a symptom. They're not designed to get to a root cause, right? These are very different ways to handle a case, right? Symptom management versus root cause treatment. Symptom management creates a lifetime patient. Root cause treatment gets rid of the problem and allows you to go about living your life, right? Doing your business. Business model, this one continually makes money. This one over here makes money in the short term because they provide a service that gets you well, and then hopefully you don't have to come back and use them. Interesting paradigm. But what we're running into and what I am finding is that for us in the upper cervical world, we do a different assessment of the neurological system, and we also do a different assessment of the structural system. And that when those two align and they show us that there is indeed a problem with the biomechanics of the upper cervical spine, we have the data, the evidence, and the scientific truth to show the patient that there is indeed an underlying problem. It is caused by the top bone of your neck, and through restoration of normal biomechanics, we will alleviate the underlying neuropathophysiology and restore normal expression of health for you. It's that simple, right? However, when we start showing you these tests, one of the most common things that people love to do is to say, well, hey, doc, I need to take this information to my neurologist to ask them about it. So let me get this straight. The very person who told you that everything is normal, you are going to take them data and evidence from a upper cervical chiropractor who is trained in a separate and distinct manner than the neurological or the ENT or the orthopedic is, and you're going to take their judgment and their critiquing of a separate and distinct profession. You see, that would be like in my world of me going to a plumber and asking the plumber if he knows how to do the electrical harnessing inside of my house. Those two don't cross, right? May the plumber have an idea about some electrical because it's part of his work? Sure, but does he understand the intricacies of how you wire a panel and how you navigate that structure? No, right? They are separate and distinct. It's not the same, right? That'd be like me going to a car salesman and asking him about a washer, right? Those things don't go together. And so what's interesting to me is that sometimes there are limitations to what Western medicine provides in the testing world for you. And what's fascinating to me is that they are very good at doing their test when it all lines up, just like we are very good at doing our test when it all lines up. You see, this isn't a either or, it is a which test is done that will necessarily get to the foundation of the problem and help the patient restore normal in their life. What I see and what I often run into in my life is that most of you have an underlying upper cervical problem. Sometimes it needs a neurological system evaluation. Sometimes it needs an ENT, right? But not all the time. In fact, I would actually suggest to you that the first stop on your bus when you're going through these testing schematics should actually be at the consultation that the upper cervical doctor offers to find out if the connection between your brain and your body is working. If that is all good, then it warrants the further discussion of going into a different and separate and distinct field. However, the flip side is what normally happens is we start at the PCP, urgent care facility, we end up at the ENT, the neuro, the cardiologist, the orthopedic, the infectious disease specialist, and the next thing we know, we're like, hey, we're at a loss of words, we're at a loss of time, we're at a loss of money. We spend about a year of our life trying to find answers and nobody gives them to us. And then we find out about this thing called upper cervical and we wonder why we were never told about this in the first place. So my plea to you today is that when all your tests come back normal, the very next stop you need to make is at an upper cervical practice. And the easiest way to do this is to go to uppercervicalcare.com, type your zip code in, find the doctor closest to you and call them. Find out if they offer a complimentary consultation. Tell them that we referred you because we as a profession work together to ensure that that patient is taken care of, that you are given the right direction, you are led to the right space, and that that doctor is competent in showing you through the art of computerized infrared thermography with biomechanical x-rays that they are able to actually prove to you that their underlying root cause is a problem in the connection between your brain and your body originating at the top bone of your neck. Doesn't matter what the symptom is. Doesn't matter if you have neck pain or if you don't have neck pain. Doesn't matter if your neck is tight or if it is loose. It doesn't matter on any front because the control mechanism of the body originates at C1, top bone of your neck. And when you restore normal biomechanics, it changes the way that all the messages go into your brain and out of your brain, especially the ones that deal with healing. So why wouldn't you go through that process of making sure that you have a strong foundation and that all your symptoms are nothing but a neck problem? You see, the problem that we run into is that we associate pain with problem. The difference is that in the upper cervical world, we evaluate clinical function with an underlying problem. So when you are tired and sick of chasing medical test after medical test and coming up short with a normal testing result, the next stop on your bus is uppercervicalcare.com and find one of us who can truly set you on the trajectory to restoring health.